Okay. Hello, good day. Kumusta? Parang bagong topic, ano? So, this topic, this concept, we will talk about endocrine disturbances. Now, I wanted to pay attention on this concept because every NCLEX, lumalabas ang endocrine. Hindi nawawala ang endocrine sa NCLEX question. Okay? I don't know why they love endocrine system so much. Okay? So, I wanted to pay attention on this system because it's quite complicated, but you don't have to memorize everything. Because all you have to do is that in your endocrine disturbances, there are only two imbalances, hyper and hyposecretion. So you say hypersecretion, there's excessive production. In hyposecretion, there's deficiency. So alam mo na, if the condition is hypersecretion, the management is what? We give inhibitors. If the problem is hyposecretion, the management is supplementary. Did you get that? And you don't have to memorize all signs and symptoms. Tandaan mo lang yung isang sakit. Kung gusto mo ng hyper, edi hyper lahat i-discuss mo. Baliktarin mo lang yung hypo. Ibig sabihin, kung itong disorder, ang hypersecretion niya is tachycardia, ano yung hyposecretion? Bradycardia. Ito diarrhea, ano dito? That is why you don't have to make it hard for yourself. Am I right? You need to understand the concept, yun. Ang problema, gusto mo namin intindihin ang concept, sir. Wala kami mahina ang anatomy and physiology na foundation. Yun ang problema ng estudyante. Kaya doon ako magsisimula. Okay? So this is your endocrine system. Okay? Okay? Your endocrine system. Okay, makinig muna. When I say endocrine system, it is considered to be a ductless system. Ductless gland. Can you follow? It is a form of a ductless system. Ano bang ibig sabihin ng ductless? Walang duct, walang daanan. Therefore, kung wala siyang daanan, wala siyang duct, pag nag-produce siya ng substance, saan diretso yung substance? In the blood. Can you follow? Therefore, yung pinuproduce na hormone ng endocrine gland, diretso yan sa blood. Magkakaroon ba kaagad ng effect? Hindi po. Ang effect niya, dun lang sa structure na target niya. Can you follow? Okay, this is the pathway of our endocrine system. So this is the hormonal. This is the hormonal pathway. This is the thing you need to understand because this will be the backbone of our endocrine topic. Okay? Now look. Hypothalamus, familiar? Regulates the activity of your pituitary gland. By the way, what is another name of your pituitary gland? Correct. Very good. Hypophysis. Hypophysis. That is another name. Once stimulated, pituitary gland produces hormone. Can you follow? Once stimulated, pituitary gland produces hormone. Paglabas ng hormone nurses, pupunta yung hormone sa target niya na structure. Can you follow? Goes to its what? Goes to its target cell or target what? Target structure or structures. Pag pupunta siya sa target structure niya, doon magkakaroon ng effect or effects. Maliwanag? Ulitin ko Hypothalamus regulates the activity of pituitary gland or hypophysis. Once stimulated, pituitary releases hormone. Once hormone is released, it goes directly to your blood and goes to its target cell or structure. When that hormone reaches its target structure, that's the time there will be an effect. Therefore, ang tanong, are hormones specific?
Yes.
Hey, are hormones specific? Yes, they're specific. Pag pupunta siya sa target niya, dun lang may effect. Did you get that? Pag pupunta siya sa organ na hindi niya target, may effect wala? Walang effect. Let me give an example ng hormone. Example ng hormone. Ricafort's hormone. Yan. Ang Ricafort's hormone, ang target niya daw, lalaki. Did you get that? Pag pupunta siya sa babae, walang effect. Target lalaki. Specific girl. Did you get that? Let me give an example. You know this? Mammary gland. This is the nipple. Naka-side view po yan. Okay? Baby, this is you. Okay? Please bear with my drawing. Okay? Sabi ni baby boy, I need milk. I need milk. Your mom will offer her breast. Here, baby, here, baby, here. You will suck the nipple. Pagsak mo ng nipple, malalaman yan ng hypothalamus. Sabi ng hypothalamus, aba, may sumuso sa kaliwang breast. Anong gagawin ng hypothalamus? Ite-text ng hypothalamus ang pituitary. Nagte-text yan sila. Message sent, tanggap ng pituitary. Sabi ng pituitary, nag-text sa akin yung hypothalamus, may sumuso daw sa kaliwang breast. Kailangan ko nung i-produce yung hormone. Anong hormone ang i-produce ng pituitary gland with respect to the stimuli? Answer, oxytocin. Question, is oxytocin a hormone?
Yes.
Are hormones specific?
Yes.
May target ng oxytocin.
Yes.
Ano ang target ng oxytocin? Sagot, mammary gland and uterus. Say it.
Mammary gland and uterus.
Again, ano ang target ng oxytocin?
Mammary gland and uterus.
Pag pupunta ang oxytocin sa target niya, magkakaroon ng effect. So tanong, what will happen now pag pumunta ang oxytocin sa mammary gland? The mammary gland will contract to release the milk. Ang tawag dyan, milk ejection or let-down reflex. Pag pupunta ang oxytocin sa uterus, it will contract to prevent postpartum bleeding. Kaya after delivery, we give syntocinon, oxytocin drip. Oh, specific?
Yes.
Yes. Did you get that? So don't forget the hormonal pathway. Naintindihan ba ito?
Yes.
Yes, naintindihan. Ang problema ng nurses, hindi alam ang mga hormones. Can you follow? Doon nagsisimula yung problema. Pag hindi mo alam ang hormone, hindi mo ma-identify ang disorder. Can you follow? Pwede rin narinig na ang hormone, hindi lang alam kanong effect niya. Am I right? So go back tayo sa anatomy. Look, pituitary gland nurses is divided into two. Okay, by the way, what is another name of your pituitary gland? Hypophysis. Pituitary is divided into two, the anterior and posterior. Remember, anterior pituitary gland is called adenohypophysis. Okay? Posterior pituitary gland is called neurohypophysis. Are you with me? Adenohypophysis for your anterior, neurohypophysis for your posterior. Question, how many hormones pinuproduce ng pituitary gland? Depende yan, sir. Anterior ba or posterior? Tandaan nyo lang. Anterior pituitary gland produces 7 hormones. Posterior pituitary gland produces 2 hormones only. Let's identify. What are hormones produced by the anterior and produced by the posterior? Okay, anterior, ilang hormones? 7. 1, 2, 3, 4, 5, 6, 7. Posterior, ilang hormones?
2.
Only 2. Identify hormones produced by the anterior pituitary gland. You have your GH. What's GH? Growth hormone. Good. You have your MSH. What's MSH? Melanocyte stimulating hormone. Good. You have your prolactin. Familiar? You have your FSH, LH. What's FSH? Follicle stimulating hormone. What's LH? Luteinizing hormone. Good. What else? You have your TSH. What's TSH? Thyroid stimulating hormone. And last is your ACTH. What is this? Adrenocorticotropic hormone. O bilangin mo, 7 lahat. 1, 2, 3, 4, 5, 6, 7. Complete. Correct? Posterior pituitary gland produces 2 hormones only. And what are this? ADH. What's ADH? Antidiuretic hormone. Or what is another name? Correct. You call this a vasopressin. Tama po ba? We call that a vasopressin. And the last hormone produced na bakit na natin kanina, ano yun? Oxytocin. Maliwanag? Maliwanag ba? Are you with me? Okay, again, how many hormones produced by the pituitary gland?
7.
Anterior?
2.
Posterior? 2. Anterior?
7.
Posterior?
2.
Total of?
9.
Ang galing nyo talaga sa math. Okay, 7 plus 2 equals 9. Question, yung 9 na hormones, sir, dyan, i-discuss mo ba yan sa review? Sagot, hindi. Out of 9, 3 hormones lang ang dinidiscuss ko sa med search. Anong hormones na yun, sir? TSH, ACTH, and ADH. Silang hormones lang i-discuss sa med search. Why? The rest of the hormones, i-discuss yan sa pedia and OB. Can you follow? At least alam niyo yung partition. Did you get that? Can you follow?
Yes, sir.
Clear. What I am going to do now is I will give you the bird's overview of the different imbalances. Para bukas, pagbalik natin, dire-diretso tayo ng lecture. Maniwanag ba? Okay. Shall we start with your TSH? Okay? Shall we start with your TSH? Hello?
Yes, sir.
Thyroid stimulating hormone. Question. Who produces TSH? Who produces TSH? Correct. Anterior pituitary gland. What is the target of your TSH? Correct. Very good. The target is your thyroid gland. Very good. Maniwanag ba? Ngayon, ano ang gagawin ng TSH sa thyroid gland? To stimulate the thyroid gland to produce its what? Hormone. So once stimulated, thyroid gland produces what? It produces thyroid hormones. How many thyroid hormones are being produced by the thyroid gland? 3. You have your T3, T4, and last is your thyrocalcitonin. Naalala niyo to? I hope so. What is another name of your T3? T3 is your triiodothyronine. Can you follow? T4 is your tetraiodothyronine. Or, other name for tetraiodothyronine T4 is thyroxine. Can you follow? You call this as your thyroxine. Maliwanag ba? Question. From what substance derive ang T3 and T4? Again, from what substance derived ang T3 and T4? Kaklaro ano? Ayo. Again, salamat Lord, from iodine. Thank you. Can you follow? Derived from iodine. Did you get this? Okay, question, sir. Para sa ano ang T3 and T4? T3 and T4 are hormones that will increase your basal metabolic rate and will also increase heat production. That is why pag increase ang metabolism, will that cause tachycardia?
Yes.
Will that cause chest pain? Yes. Kaya nga sabi natin, when we talk about cardiac abnormalities, there are drugs that once given to your patient can cause chest pain. One there is your T3, T4 hormones. Am I right? Ano ang tawag sa angina pectoris induced by drugs? Ano ang tawag sa angina pectoris na drug-induced? Remember, there are different types of angina. Stable, unstable, variant, intractable or refractory, silent, na kinanta yung silent night, naalala nyo doon? At saka yung Ludwig's angina. Saan doon? Ludwig's angina. Oh, nakalimutan ang tawag doon, amnesia. Okay? Balikan niyo yung concept. Huwag yung kalimutan yung mga concepts natin. Okay, clear? Clear? What about thyrocalcitonin? Thyrocalcitonin is a hormone that will decrease your what? Blood calcium, but will increase your what? Correct. Your bone calcium. Naalala niyo to? Okay? Siyempre, malamang nakalimutan na naman niyo. Okay? It decreases calcium level in the blood, but will increase calcium in the bone. Okay, BMR is basal metabolic rate. Clear? Hello? Finish? Okay, everybody I see you. Look at the summary. Look at the summary. Eyes here. Ano ang tawag sa disorder pag increase ang T3 at increase ang T4? Correct. You call the condition as your hyperthyroidism. What is another name of your hyperthyroidism? Mga addisons, ibang endocrine disorder yun, okay? Ano ang other name ng hyperthyroidism? Correct, thyrotoxicosis. Thyrotoxicosis. Give me an example of hyperthyroidism. Yung sinasabi nyo? Graves' disease. Very good. Graves' disease. Maliwanag? Okay, for you to understand this, everybody stop writing. Look at me. Hyperthyroidism, another name is thyrotoxicosis. Example is Graves' disease. It's just like saying, parang sinabi mo, antibiotic. Can you follow? Another name of antibiotic is anti-infective. Example of antibiotic is penicillin. Did you get that? Pwede ba nating sabihin, another name of antibiotic is penicillin? No, kasi maraming klaseng antibiotic. Penicillin is just an example. O ito rin, Graves' disease is just an example of hyperthyroidism. Maraming klaseng hyperthyroidism. May Graves' disease, may Pott's disease. Can you follow? Ang pinakasikat lang ay Graves. Can you follow? Good. Next. Ano ang tawag sa disorder na decrease ang T3 at decrease ang T4? Correct. Very good. We call this a short hypothyroidism. Question. Ano ang tawag sa hypothyroidism if hypothyroidism occurs sa pediatric? Or if hypothyroidism occurs sa adult? Ano ang tawag sa hypothyroidism pag nangyari sa bata? Correct. Very good. You call that as cretinism. Ano ang tawag sa hypothyroidism pag nangyari sa adult? Myxedema. Correct. Clear? Myxedema. Maliwanag ba? Take note ha. Bird's eye view muna tayo. Kailangan ko na siyang i-organize sa isip ninyo. Okay? That's the first hormone I will discuss. Next will be your one. ACTH. Correct? Who produces ACTH? Correct. Anterior pituitary gland. And ACTH stands for adrenocorticotropic hormone. Good. What is the target structure of your ACTH? Adrenal gland. Correct. Your adrenal gland. Maliwanag ba? Saan nakikita ang adrenal gland? Above the kidneys. Therefore, what is another name of adrenal gland? Suprarenal gland. Suprarenal gland. Kasi nakikita above the kidneys. So, how many adrenal glands do we have? Two, because we have two kidneys, the right and the left kidney. O ngayon, ano ang gagawin niya sa adrenal gland? It stimulates the adrenal gland to produce what? Hormones. Can you follow? So everybody eyes here. Mamaya na magsulat. Everybody eyes here. Adrenal gland, okay? Adrenal gland looks like this. Okay? Adrenal gland looks like this. Maliwanag ba? Maliwanag ba? Okay. The outer part is what we call adrenal cortex. Okay? The inner part is what we call adrenal medulla or adrenal medulla. Question, saan dito nagpo-produce ng hormone? The cortex, the medulla, or both? Ano? Very good. Mali. Cortex. Can you follow? The cortex produces hormone. The medulla produces catecholamines or catecholamines. Can you follow? Can you follow? Okay. What are hormones produced by the cortex? Okay. First is your cortisol. Second is your aldosterone. And last is your adrenal androgen. Makinig muna. Actually, 4 talaga ang hormones na pinuproduce ng cortex. 3 lang ang din-discuss sa review. Kasi yung pang-4, wala siyang silbi. That is your adrenal estrogen. It's not an estrogen produced by the ovary, but an estrogen produced by the adrenal gland. Adrenal estrogen. Kung may adrenal androgen, may adrenal estrogen. Can you follow? Yung 4. Can you follow? What is another name of cortisol? Correct. Glucocorticoid. Very good. Glucocorticoid. Will it affect the glucose? Yes. Ang aldosterone, will it affect the mineral? Anong specific mineral? Sodium. Therefore, what is another name of your aldosterone? Mineralocorticoid. Mineralocorticoid. Kuha? Next. Catecholamines or catecholamines. There are 2 catecholamines. And what are these? Epinephrine. Very good. Epinephrine. And last is your norepinephrine. epinephrine. Tama po ba? What is another name of your epinephrine? Correct, adrenaline. Ito ba yung tumataas pag emergency?
Yes.
Ito ba yung tumataas during sympathetic reaction? Yes. Can you follow? Hello? Okay. Entiende? See? Siguro, sir, siguro. Maliwanag ba? Maliwanag ba? Okay, that's the IV. Look at the summary. Okay. Ang tawag natin dito ay adrenal hormones. Correct? Ano ang tawag sa disorder pag marami kang adrenal hormones? Ano ang tawag sa disorder pag konti lang ang adrenal hormones? Too much adrenal hormones, what do you call that? Correct. We call that a Cushing, or we call that a Cushing's syndrome, or Cushing syndrome. Ano naman ang tawag sa disorder kung mababa ang adrenal hormone? Correct. Very good. We call that a Addison's disease. Clear? But there's another condition. Hindi lahat ng hormones ang tumataas. Ang tumataas lang ay aldosterone. Pag aldosterone lang ang tumaas, hindi kasama ang cortisol, hindi kasama ang androgen. Okay? Aldosterone lang. Aldosterone lang. Aldosterone lang. Ang tawag ay hyperaldosteronism. Can you follow? Another name of hyperaldosteronism is Conn's disease. Conn's disease. Conn's. C-O-N-N'-S. Conn's disease. This is different from your Crohn's disease. Ang Crohn's disease, ang spelling ito, Crohn's disease is a form of an inflammatory bowel problem. Ang kasama nito na sakit ay ulcerative colitis. So don't confuse yourself with Conn's from Crohn's. Maliwanag? Maliwanag ba? Okay, good. Next. Ano naman ang tawag sa sakit, sir, kung marami kang catecholamines? Kung marami kang catecholamines, ang tawag sa sakit ay pheochromocytoma. Okay? Ang tawag sa sakit ay pheochromocytoma. Maliwanag? Clear? Clear? Good. Next. A short ADH. Last. Antidiuretic hormone. Correct? Your antidiuretic hormone is a hormone produced by what gland? Posterior pituitary gland. Good. What is the target of your ADH? Kidneys. Okay? Kidneys. ADH is important for water reabsorption. Correct? Water reabsorption. Look at the summary. Look at the summary. Ano ang tawag sa sakit pag maraming ADH? Ano ang tawag sa sakit pag decrease ang ADH? Too much ADH, you call that a short SIAD. Decrease is what we call your diabetes insipidus. Clear? Clear? Good. Clarifications? None? Okay, copy first. Sorry. Pheochromocytoma. Pwede ko nang burahin ito na part? Pwede ko nang burahin? Okay. Okay, copy. This with the outline of our topic. This will be the outline of our topic. First, we will talk about hormonal imbalances. An introduction about hormonal imbalances. Number 2, we will talk about specific disturbances. Okay? So specific disturbances, we will start with your TSH. So sa TSH, okay, we will talk about hyperthyroidism and hypothyroidism. After that, letter B, we will talk about ACTH abnormalities. Okay, kasama dyan ang Addison's and Cushing. Then, letter C, we will talk about ADH imbalances. Kasama dyan ang SIAD and diabetes insipidus. Clear? Then, letter D, lagay natin dyan, others. Others. So, sa others, ano to? Dito na i-discuss ang Conn's disease. Familiar? Familiar?
Yes, sir.
Conn's disease. Dito i-discuss ang PTH abnormalities, that is your hyper, para, and hypoparathyroidism. Hyper, parathyroidism, and hypoparathyroidism. Others, dyan i-discuss ang pheochromocytoma. And last topic, diabetes mellitus. Diabetes mellitus. So pag hindi pa tayo discuss ng DM, hindi pa tayo tapos sa endocrine. Clear? After DM, after endocrine, anong next concept? Respite? Okay. After DM, let's talk about respite. So this will be the outline of our topic.